Good morning. I'm Gilad Ostrovsky. I'm the Chief Forester in KKL-JNF, the acting National Forest Service in Israel. And I'm very happy to be here with you this morning. I'm happy that KKL is a part of this conference for many years. And while I'm standing here, I must tell you that climate change is actually hitting us very hard. Last winter in Israel, we had only 50% of annual mean precipitation, a very dry winter. This winter, we're now already in December, we had only a few occasions of rain, and the general feeling is dryness. And looking towards the forests, the several last month, we can see a rapid dieback of forests, mainly in the southern forests of Israel, mainly conifers and eucalypts. And sometimes it's the 90% of the stand itself. And yeah, the forecast for the coming years is less than the average in terms of precipitation. And we also broke some records of high temperature in this last year. So, talking about forest management, we have a clear perspective and a good set of tools from our strategic and guidelines coming from the School of Sustainable Management Forests, but it's not enough. And we're actually facing a changing of the nature of our forests, mainly in the southern parts, but also upper north. And here's come the importance of the research. Actually, KKL is managing for years 5 stations of LTER, long-term ecological research, 4 of them in the Negev. And we also operate a national program of LTM, long-term monitoring of about 90 plots all along the Israeli gradient of conifers, Halepensis and Brutia. And we also manage about 30 to 40 3-year grants researches about different aspects of forest management in Israel. It's for decades, KKL is actually investing in this field. And this is one of our main way to try and understand what is happening, the dynamics, and maybe to find some solutions or directions to how to manage and to act in face of this climate change. And that connects me to this important conference about research, about finding solutions, and very important to meet you, to have gathering, to learn from the experience from other countries, to think of new projects. And I wish you a very interesting conference, meaningful and useful meetings, and leave some time to explore the beautiful surroundings of Sde Boker. Don't forget it. So good day, everyone, and good conference.
Okay, so I just want to say to anybody who wasn't here, so we have over 1,000 registered participants, yesterday close to 700, from 39 different countries and 52 different sessions. So please try and look and explore the different sessions. And now I'm very, very honored to have Dr. Emmanuel Ndindi from Malawi. Yesterday I spoke to him. I didn't know the language. In Malawi, it's called Chochni, right? Chichawa. So I want to say Zabuena Zoise. Yeah? And I welcome you. Thank you very much. It is our great pleasure to have you.
All right, thank you so much. First of all, let me thank the chair of the organizing team for according me this opportunity to talk at this conference, an invitation which was facilitated through Prof. Anat Lozenzo, who works with us for so many years now, since 2008, 10, somewhere there. I don't take this opportunity for granted. Let me thank the previous speaker for setting the ground for my presentation around issues to do with climate change. I'm a medical doctor with public health specialization for 24 years working in the communities, leading health systems in the district. And I've been participating in these presentations from yesterday. And let me also ride on Prof. Bennett, who presented yesterday. He talked more about systems, sustainable production, and consumptions. So what I want to say is usually what we see as health issues, they are usually at times failures of certain systems or due to certain catastrophes. For example, if there's a drought, it means the harvest will be bad, the population will be starving, and you see a lot of malnutrition. Where do these people, where do these children end up to? They end up in the hands of medical professionals. If there are disasters, there are a lot of things that come up, depending on the type of disasters, either injuries, which need immediate attention of the health professionals. Whether there are floods, there are so many diseases that are related to that. You talk of cholera, or even at times, even when there is no floods, but if water systems are failing, you may find that the results will lead to some infectious diseases. So my presentation this morning will talk about how the community that is already economically challenged, affected by some climatic disaster, how can a health system ensure that there is resilience within that community? So I'll pick a case study for a district where I work in Malawi. It's a very remote district. Economically, it's a district that is heavily challenged, but partners in health started working there in 2007 to support the district. So this is the outline of what I'm going to give you about Malawi itself. What is Partners in Health, setting the global stage, and I'll end up looking at what building a health system for the future would look like, and a call for global partnership and shared responsibilities. For the sake of those who don't know Malawi, Malawi is in Africa. You can see on the east we have Mozambique, on the north there's Tanzania, on the west we have Zambia, and it has 3 regions. It's a land of 118,484 square kilometers. Population-wise, this year projected at 22.2 million, and the GDP per capita is $392. Economically, this is a country that is mainly agri-based, 80%, a little bit of trade, and currently the country is realizing some deposits of mines. And the challenge is most of the agriculture production is rain-fed, despite having enough waters, as I saw in the map there. Health financing is $21 per capita. And if we include, that's on the domestic budget. If we include the donor funding, it comes to $40. And the country has had its health sector strategic plan number 2 spanning from 2023 to 2024 in order to try and achieve the universal health coverage. So the governance system of the health system is that there's a Ministry of Health which is there for policy guidance, and there's decentralization whereby services are run by district councils, and they provide local accountability and oversight. While in terms of service provision, it's done mainly by public structures, by the government, and we also what we call the Christian Health Association of Malawi, which has some facilities owned by the churches. Private sector or NGOs also do some specialized care services. So the provision of services at primary level, we look at the community health services and the health center level. Then the next level is the secondary health care, which is provided at the district health facility. And then tertiary, that's the most top part. Let me give you a talk about community health in Malawi, which spans back to 1970s. And usually these were volunteers. Then I think there was an outbreak of cholera, and they used to be called cholera assistants. But after the alma mater in 1978, the ministry changed this cadre into health surveillance assistants to increase their scope of work beyond the cholera alone. And each of these HSAs is apportioned 1,000 individuals to look after. And there's been a lot of task shifting to involve these people so that they can support in the health service delivery. So within the community aspect, we've seen a little bit of change currently from last year, whereby the country still wants to strengthen more about the national community health framework by increasing beyond health surveillance assistance to include community health nurses, community midwife assistants, and environmental health officers who are trained to the level of a degree. So let me tell you about Partners in Health. This is an organization which came to Malawi in 2007, initially from Boston. That's where it's headquartered. And the mission is to accompany the Malawi government in advocating, designing, and implementing universal health systems. And it arrived in 2007, basically works on health system strengthening by looking at what we call the 5 S's. Firstly, looking at the staff to support the provision of health services, staff as in supplies, spaces, systems, as well as social support to the community. PIH Community Health Program Overview started in 2007 when they just came in. This was to supplement on the shortages that were there for the health surveillance assistance. So basically these HSAs were apportioned households. Unlike for the HSAs where you are apportioned individuals, these ones are apportioned households, and they support the government system. And among the things which these could do was to identify conditions within the households, enhance adherence to treatment, and take these people for screening in facilities. So we all know that climate change and economic fragility are now the biggest threats in Africa and the world as a whole. And these disasters are no longer occasional. They can happen at any time. Neno is one of the districts that represent a fragile economy that can face repeated shocks. Why we'll see as I'll proceed in the presentations. So the issue within here is that the setup or the lessons of what I'm going to present, we feel they represent the global health, its relevance for the global health, security, and climate resilience. Whenever there are climate disaster, the roads are affected. If people have to go and access services, the roads become impassable. We usually see outbreaks of various diseases after disasters. In Africa, being in the tropics, you look at cholera, increased cases of malaria, malnutrition, and usually the most affected are the vulnerable populations. So this is a map of Neno. It has a population of about 160. The district is in 2 phases. The other part, the lower part, is more along the longest river that drains from Lake Malawi into the Zambezi. And its climate is somehow a bit different from the upper part, which is more mountainous, and has challenges with a lot of infrastructure, road networks, and the terrain itself is a little bit hard. And the district has 2 secondary care facilities and 13 health centers, of which some are for government, CHAM, as well as private facilities. Just to give you a picture, I think you can see, this is one of the roads that takes us up to the mountains, where there's a headquarters for the district governance structure. And on the right there, that's one of the villages in the district. So this gives you the picture of what the economic situation might be of the district. There's usually rising inflations in the country, which also affects the community. And with all this economic fragility, you find that it has cascading effect on the health system's capacity, which also transcends down to the community. And without stable financing, it's hard to achieve the universal health coverage. So let me give you a snapshot of what climate challenges Malawi has experienced. In 2015, there were huge floods through the biggest river that drains through Lake Malawi, going down to Zambezi to Indian Ocean. And in 2019, there was a tropical cyclone, Cyclone Idai, which came from the Indian Ocean through Mozambique, ended up in Malawi. And in 2022, another Cyclone Ana and Gombe. And 2023, Cyclone Flede, which also killed quite a huge number of people. And last year, Neno district within Malawi is one of the districts that has been affected by huge drought. So whenever cyclones happen, they affect all the systems: education, agriculture, energy, road infrastructure, housing, and the health system. One of the cyclones, Ana, affected 1 million people, and within Neno, 27,000 people were affected, and it was the 5th affected district. And Flede, across the country, affected 2 million people with 500 deaths. So on the right, those were the effects of some of the cyclones. And I talked about the road infrastructure being affected. The bridge up there is one of the bridges that leads us to one of the health centers. And after the bridge was cut off, it still stands out now. Whenever it's raining, the fellows from that health center, be it for maternity cases, it's affected because the facility does not have a theater to operate in case they need some cesarean sections. And I've talked of the drought. That's what we see on the right as well, down picture, whereby the harvest were completely affected. So you can note that repeated shocks does erode the system's capacity, and the recovery can be a little bit difficult in such situations. Diseases, high number of cholera outbreaks after the cyclones, and this also affects so much health workers. You can see in the picture down there a makeshift treatment center for cholera cases. Following disasters, usually there are heavy pressures on the health system. So be it in the supply chain, on the health workers, as you can see down there, health workers in the community working under a tree to make as possible sustain and provide services to the population. You cannot talk of health services without health financing. So the other challenge is there's a lot of fragility in health financing, in the sense that Malawi is heavily dependent on donors. Probably the situation is not only for Malawi in Africa, but most other African countries have the same. We've seen the cry, the challenge when there's been dissolution of the USAID. And there's limited domestic financing for health services, and this makes challenges in terms of procurement, staffing, and the continuity of care. So without new financing models, health systems can be too fragile, and therefore the setting needs to remain reactive rather than proactive. So how can we ensure that the system remains resilient? Our success in NENO comes from strengthening or starting the approach from the community level, whereby we set the community volunteers who support the community health systems and provide support in various areas around health. And the community ownership is very vital for a sustainable health service and ensures rapid response whenever such disasters occurs. Resilience can only be achieved when communities are empowered, and the community health volunteer system is one of such approach which we feel could support the same. Apart from that, what other system can we try to engage? We need to be innovative, trying to innovate the service delivery by, among other things, bringing mobile clinics closer to the people. And once this is done as a routine, whenever there are such outbreaks or such disasters, you ride upon them and ensure that there's sustainability in terms of such provisions. And in terms of provision, integration is very key, so that you take all the services to the people. This is not one of the temporary measures, but a strategic approach, and it can ensure availability of services regardless of whatever infrastructure damage might be there. So these are the ambulances which Partners in Health bought and gave to the local council in the district to sustain their outreach mobile services. Yeah, continuity of care during crisis. The district has shown that this is one of the essential services, and it can be possible during the floods, cyclones, and economic shocks if you start investing in this well before such occurrences happen. What are the key lessons that we have learned from the NENO approach? One of them is that resilience is built through long-term investments and should not be built from the emergencies. And community health workers or community engagement is the backbone of service delivery in fragile environments. And integration ensures sustainability and improves efficiency. And the evidence decision is very vital to implement the same. Strategic imperatives for fragile settings. We should ensure to build a climate resilience system by design, not by reaction. And the infrastructure should be adapted to withstand extreme weather, such as when these disasters happen. Local supply chain systems must be strengthened, and domestic financing for health must increase gradually over time to reduce vulnerability. Why is the nano experience matters globally? This reflects that many districts across Africa that are affected similarly to nano due to climate changes and economic fragility. They must be existing within Africa. And the lessons provide valuable insights for global health policy, resilience planning, and climate adaptation strategies. And investing in local health is an investment in regional and global stability. And that climate crisis is a global health crisis, and the fragile communities should be on the forefront. Financing for health in climate-affected world, short-term emergency funding cannot work. There's need to think of long-term. Health must be integrated in the climate financing. Long-term predictable funding is essential to build infrastructure, health worker training, as well as sustain the services. And the climate resilient health systems are not optional, but it's a necessity for global health security. What can we do to build the health system for the future? Systems should be climate-proofed to remain operational during disaster. Supply chains should be shock-resistant. And health information system should predict future disruptions or what might be coming. And communities should be empowered as drivers of health resilience, not only beneficiaries. A call to global partnership and shared responsibility. The challenges faced in NANO are a preview of global vulnerabilities that demand collective action. True partnership means aligning investments with national priorities and long-term system strengthening. And this is not a charity, it is a call for strategic investment. What are the final reflections from this? Climate change will continue to test the resilience of our health systems and the unity of our global community. Resilience should not be measured, should be a measure of survival against all odds. It should be a fundamental right for every person. And the decisions that we're making today would determine whether health systems in fragile environments collapse or not. Together we have the power to ensure that we even face the economic fragility and climate disaster and access essential health services in an uninterrupted manner. Thank you so much.
Thank you very much. So, questions? Nadav, Tamir?
First, thank you so much. This was a great presentation, and I wonder if you can tell us more about the burnout and also resilience of those who are working in such circumstances, it seems almost impossible. So you mentioned it briefly, but if you can tell us more. Of course, this is also relevant for other countries, because it's devastating to be for so many years in such incredible tough situations. Thank you.
All right, thank you so much. Our nurse to patient ratios, they are very bad, they are not good. They are one of the lowest in the world. The district can have 2 or 3 medical doctors now, with some clinical officers who are at the diploma level. However, 85% of the population stays in the rural areas. So the country thinks of, and most of the issues that come up, they are issues which, when they are tackled right in the community, from the preventive aspect, might not escalate into those that need secondary care. So the government has strengthened the community health systems framework by ensuring that we increase on the numbers of health surveillance assistants for surveillance of various conditions whenever they might arise. So as we are trying to build this system, let's focus from the preventive aspect, look at the trends and epidemiology of the conditions that exist in the system, in the community, and you strengthen to focus on prevention so that these don't arise. Thank you so much.
Thank you for the important talk. You showed the devastating effects of the floods. Now, Google Research initiated prediction algorithm that can allow the evacuation of people ahead of time. Are you doing that in Malawi? Have you engaged in that?
All right. After the last cyclone flood, whenever there are alert warnings, because whatever cyclone starts in the Indian Ocean, it still passes through Mozambique, Malawi, and may go to the other countries. So whenever there are such alerts, the areas, the expected areas where it will go through, the communities are alerted. They are made aware through either public address system during the night, so that they should prepare and what is it that they can do whenever such things happen. So with that type of alert warnings, the community is involved and advised on what to do whenever such things happen. Those who are in the low-lying areas, along the river, along the lake, they have to move up. Yes.
I enjoyed your talk very much, and I think that it's relevant to everyone. But both disasters are different in different places, and cultural aspects of resilience are also very different. Now, I'm wondering if you had any ways of comparing what did not work for you, but worked at other places. What supported resilience for you does not support resilience in other places, and more importantly, what failed in your cultures and worked in other places. Do you have any of that kind of information?
Okay, thank you so much, Prof. Dan, for your question. I think in resilience, there are quite a number of players. The culture aspect comes in, the economical aspect comes in, the service delivery issues comes in. When you look at the country, what I've given you is a snapshot of one district, but all the districts across the country, they try to implement the same. Most of the environment or the existence is all the same across the whole country. So the engagement is uniform. However, probably because where we are working, we are supporting, we came in with extra support for the staff, as I said, which other districts might not have. And the community system framework within the district might be a little bit better because this employed the household approach rather than where it was just played to the population.
A great talk, Henry. Thanks a lot. Just a quick question in terms of drought resilience. It seems a lot of it depends on water distribution. If you had all the money that you needed, what could you do to increase drought resilience in terms of keeping crop production going?
Thank you so much. In my presentation, when I was giving the outlook of the country, you can see that lake, it spans from the north almost down to south. And agriculture-based is rain-fed, not much of irrigation. So if investments were done around irrigation for food production, probably the country would be self-sustainable. Along the shores, there are companies which are producing sugar. If the same could be emulated to produce enough food for the people. And there's a whole river that drains from the lake down there to the tip into Zambezi. And there are also various rivers draining into the lake. So if resources were available, engaging irrigation would ensure that drought effects are mitigated.
Okay, one question, last
And
question.
this is a freshwater lake. Yeah.
Okay, so we would like to thank very much Dr. Emmanuel.